I'm Tom Pickles. I'm a radiation oncologist at the BC Cancer Agency in Vancouver. I spend a lot of my time seeing men newly diagnosed with prostate cancer, and then I go on to treat them with external beam radiation or brachytherapy or follow them for active surveillance. And I refer patients to support groups fairly early on in their disease course. And I've been asked to speak at support groups, typically once or twice a year. For me, the biggest challenge that the patients face is the initial decision about which treatment to undertake, or any treatment. And some really struggle with whether they should have surgery or brachytherapy. Many of the ones who go on to surveillance are more comfortable once they've seen myself. They often have come from a urologist who has also recommended surveillance, and then I'm a sort of second opinion. And so they struggle less with the decision making. But the guys who need treatment and are suitable for 2 or 3 different treatment options sometimes have a lot of difficulty. And I think potentially they have a lot to gain from the support groups. Of the men who go to a support group, I think those who are most likely to gain in terms of their trajectory within the disease is probably early on when they're making a decision. I'm not convinced that they're going to get an answer at that stage, but I think they have the most need for support. And then later on, perhaps with significant toxicity, incontinence, erectile dysfunction, to hear of other people's tips and experiences. With a PSA relapse, I think there's a lot of concern about the PSA numbers going up, and to look around the room and hear of other men who are perfectly fit and well with no symptoms at all in the same situation, I think would also be very reassuring to them.